You may have had a doctor tell you you need a stress test, but what exactly is a stress test? Stress test basically is a test to determine if you're getting adequate blood flow to your heart, especially under conditions of stress. Stress testing may seem a little complicated because there are multiple different types of stress tests, but all stress tests actually have two things in common. One is a source of stress, which basically is a way to get your heart going. And the other is a way to measure that stress and the response of what's happening with your heart. Classic type of stress test is an exercise treadmill test. And this is quite straightforward. Basically, we put you on a treadmill under a specific protocol and have you ramp up your activity every few minutes. While this is happening, you're hooked up to an EKG and a blood pressure cuff. And basically, we measure responses. And specifically, we look for classic EKG changes that suggest whether you're having ischemia or lack of blood flow to the heart because of a developing blockage within one of the arteries. If you can't get on a treadmill, there are other ways to do stress testing. In fact, we can give a pharmacologic stress, which is the type of stress where we give a medication that can either speed up the heart or dilate the blood vessels, and that works just as well under most circumstances. Additionally, we sometimes will couple the EKG portion of the stress test with other forms of imaging. And a popular one that we do in the office is called exercise stress echocardiography, where we take images of the heart before and after. And for patients who have a significant issue and have an abnormal stress test, part of the heart doesn't contract normally when under stress, and this is a telltale sign that there could be a blockage in one of the arteries. Beyond echocardiography, there are other forms of advanced imaging that your cardiologist might recommend for your stress test. So if you're curious and want to learn more, it's important that you talk to your cardiologist about the type of stress test that you're going to undergo so you have a better idea of what to expect and what kind of findings could be discovered.